Hello and welcome to Ask the Experts, brought to you by Salinas Valley Health. I'm Claudia Otero. Today we're going to be focusing on cardiovascular diseases, risk factors, how to prevent them, and treat them. Our expert today is Salinas Valley Health interventional cardiologist, Dr. Rikin Kadakia. Thank you for being here today.
Thank you for having me, Claudia.
Of course. Now, before we get started, can you tell us a little bit about yourself?
Sure. Hi, everybody. I'm Rikin Kadakia. I am one of the newly appointed staff physicians at Salinas Valley Health. I am a board-certified general cardiologist and invasive cardiologist. I am originally from New York. I have done my general cardiology training at Ochsner in New Orleans, which is a global expert in advanced heart failure and heart transplant. And in terms of my invasive cardiology, I have trained at Scripps Clinic in La Jolla, which is, again, one of the global leading experts in complex heart interventions. Cardiology has always been a passion of mine. Ever since I was in 5th grade, I made a Play-Doh model of the heart, including 4 chambers, and since then I've just been gravitated towards the field of cardiology. Furthermore, when I was an EMT and a nursing assistant in a cardiothoracic ICU, I had some really good mentors who allowed me to follow my passion, and this is where I am here today.
So for young people who are watching, who are thinking about maybe going into the medical profession, don't know exactly what they want to do you have a piece of advice for them?
Absolutely. If you want to go into medicine, I would say first try out, be an EMT, being a nursing assistant, see if medicine is for you. If it is, there's so many different options available to get your hands and get a really fulfilling career in the field of medicine.
Great advice, and we thank you for that. And we're very happy that you're a part of our medical staff at Salinas Valley Health.
Excited to be here.
Yeah. Well, I do want to begin with the following slide. According to the World Health Organization, cardiovascular diseases are the leading cause of death in the world. An estimated 17.9 million people died from cardiovascular diseases in 2019. That was 32% of all global deaths. Of those deaths, 85% were due to heart attack and stroke. And it's important to note that most cardiovascular diseases can be prevented, and we're going to be talking about that. They can be prevented by changing your behavior or those behavioral risk factors. Can you provide a brief overview of what cardiovascular diseases entail?
Absolutely. So you gave a really graphic probability of how the cardiovascular disease is one of the leading causes of death in the world. That number is going to continue to trend up as more and more patients live longer. And we're going to see more and more of these patients with heart problems. When we talk about cardiovascular disease, we're talking about the heart and all the plumbing system that the heart comes with, all the tubing and the channels which the heart allows the nutrition and the oxygen supply to all the organ system. So if you have blockages or plaque buildup within the neck vessels, you can have carotid artery disease, which can lead to stroke. If you have blockages in the heart vessels, you can have heart failure or heart attacks. Blockages in your kidney vessels can lead to kidney failure. Similar to the vessels of your leg can lead to blockages in the legs, preventing patients from having a fulfilling life where they're able to do all the activities. The combination of all of this, we call it cardiovascular diseases. The role of a cardiologist is not just to prevent and treat heart problems, but is also to reduce the risk of stroke, kidney failure, prevent blockages in your legs, and also treat and take care of patients who have blockages in their heart vessels.
Fascinating, and obviously you just drew a picture for us of everything that is cardiovascular diseases and the role of a cardiologist. So thank you for that. What are the risk factors for these conditions?
Traditionally, with risk factors, we have 2 different types of risk factors. One is what we call non-modifiable, which means things that we cannot change. Family history that poses us as risk for having early heart problems, or genetics. We cannot simply change that. Now, the course of our careers, I do feel that genetic therapy or gene therapy may change the landscape of this treatment. For now, we are not able to change that process. Modifiable risk factors, things that we can certainly change, such as treating your hypertension, treating diabetes aggressively, cholesterol, smoking, quit smoking cessation, treat obesity. Most important thing is exercising. We're not having enough activities on a day in, day out. AHA, the American Heart Association, recommends 150 minutes of moderate exercise. That is about 30 minutes, 5 days a week. I stress all my patients that is one of the biggest modifiable risk factors that we can reduce the risk of having all of these crippling risk factors, and that can make us healthier. Smoking cessation is a big part of it. As you quit smoke, you risk your chances of having stroke, kidney failure, heart attack. Those are the big things.
What do you say to a person, though, who's been smoking, let's say, 30 years, and they say, well, doctor, I mean, I've been smoking 30 years.
Yeah.
Is this really going to help? Will it help?
Certainly. As soon as you quit smoking long term, it will reduce your risk of smoking. And yes, there are patients who have not had the complications of long-term smoking, but eventually they will develop heart problems, strokes, and lung problems from long-term smoking. More importantly, in the day of technology and medicine today, we have adjunct therapies that we can offer our patients to help quit smoking without having the side effects of not being able to smoke. And so that will additionally make it easier for patients to be able to quit smoking if they have been smoking for 30 years.
No, that's great. And I didn't know that we had those tools
Yes,
in the
absolutely.
toolbox, so that's great. Common symptoms. What are they?
So common symptoms for heart problems, we call them the cardinal symptoms. So typically patients will have chest pain with activity, or shortness of breath with activity. Those are the common symptoms that patients will have that have blockages to their heart. The reason why that happens is because you can have plaque buildup, and at rest, that plaque allows the heart to have enough blood flow where symptoms don't develop. Once you start working, the demand of the heart is exceeding the actual supply, and that's when patients start to having heart problems and chest pain. We call that angina. Other things that patients can have is heart failure symptoms. So patients cannot lay flat because they have fluid buildup in their lungs, or swelling in the leg because the fluid is built up in your legs. Those are the most common signs and symptoms of heart problems.
And do symptoms vary from man and woman?
Yes, absolutely. Traditionally, women have what we call atypical symptoms. So women can sometimes have abdominal discomfort, back pain, or shoulder pain, not the classic chest pain that men will have. And that's one of the things that as a cardiologist, we frequently look out for those symptoms because women can present atypically.
And I've heard this, and maybe you can explain this a little bit better than what I'm remembering, but for women, when they get to a certain age, they're more likely to develop heart disease.
Yes.
Is that accurate?
Yes. Women are protected because of hormonal changes, estrogen, progesterone. As they become postmenopausal, the risk factor is identical to that of the male. That's why traditionally women under the age of 55 have a lesser risk of developing cardiovascular diseases because the hormonal changes protects them from having those blockages in the heart vessels to the neck.
Interesting. Okay. So just another reason why we should all be going to see our doctors on a yearly basis, getting those physical exams
Yes.
and blood work just to make sure that everything's as it should be.
Absolutely. Routine follow-up, either that's with a primary care profession or a nursing practitioner, is utmost important at least once a year to make sure your cholesterol panel, your diabetes, your routine kidney and liver function are within baseline. If we do find an abnormality, we certainly should be addressing it.
And speaking of abnormalities, we have a patient, let's say, who goes in for their physical. The doctor hears a murmur in their heart. So then what happens then? I mean, how do you move forward to figure out what's happening with that patient, and how do you diagnose some of these illnesses? Or
generally, if the murmur has been identified from a primary care practitioner, they would refer to a cardiology. We would see the patient, make sure that's not something that is a new occurrence. A lot of patients will say, I've had a murmur all my life. There are murmurs that can be benign. So those murmurs are something that patients can have. It's just what we call a flow murmur that just we hear blood crossing the valve, not necessarily pathological or a disease process. There are some murmurs that are what we call malignant, which means they are part of the disease process. First and foremost is get a full history and physical examination, make sure what the patient is telling you and make sure what we are seeing. The next step is doing a series of cardiovascular evaluation, getting an EKG, which is an electrocardiogram, looking at the rhythm strip of the heart, and echocardiogram, which is the ultrasound of the heart. Those are the two important imaging studies that we do to get a sample size of what the patient's heart is doing. If there are abnormalities identified, then we move on to things such as a stress test or a CAT scan or an MRI of the heart. In fact, at Salinas Valley, we have an imaging specialist. We have an imaging cardiologist who's a board certified in CAT scans and an MRI of the heart. We do a 3D reconstruction of the heart to pinpoint exactly the problem of the heart vessel and how to fix it.
And how long does that all take?
The traditional workup, we can expedite it depending on the severity of the patient. If the patient is feeling sick and ill, we can do this within a month.
Oh, that's fairly quickly. That's good to know. When you're doing this workup, as you call it, how often do you find abnormalities that are not blockages?
So that's a great question. Usually blockages are the most common causes of patient symptoms. And if those blockages do occur, we take them to the hospital. We have a cath lab where we do a procedure called a coronary angiogram. So patients come into the hospital, we get them comfortable, we get them sleepy. We use ultrasound, and we use this most of the time. We use the vessel to the wrist. We put in a hollow plastic catheters into their heart vessels and take pictures of their heart vessels with a dye under an X-ray machine. That's the best way to identify how bad the blockage is and where the blockages are. Given patient circumstances and patient characteristics, we can sometimes fix those blockages at the same time through the same wrist vessel. We call it a balloon and a stent, or an angioplasty, which a lot of our patient audience probably have heard of these medical terms before. And if they were found not to have the blockage in the heart vessels, if they were to have valvular abnormalities or abnormalities where the patients were born with holes in their heart, we would do additional testing, an echocardiogram through their mouth to see the heart image is the best, or a CAT scan MRI. If we do find them, we have special technologies and special skills at Salinas Valley to go ahead and fix it in a percutaneous manner, which means no need to open heart surgery. We can go to the vessels of the leg, or still to the wrist, or sometimes to the neck, and put in and patch up that problem.
I mean, what a relief. You don't have to undergo open heart surgery like you did maybe 30, 40 years ago. And the recovery rate is fairly quickly, right?
Absolutely. And all of these decisions are made by a referring primary care doctor, a general cardiologist, an invasive cardiologist, and a CT surgeon. We make a combined committee called the Heart Team Approach, where we talk about every single patient that goes through these complex procedures to make sure not the immediate outcome, but also decades down the road, the patient is going to do well and not needing a recurrent intervention, operation, or a procedure.
When a patient has come in and they have had some type of heart event, how do you go about educating them after?
One of the first things I do is involve the family. Patients need to have their family involved so that everyone is on the same page, because ultimately this is a joint plan. Long-term patients will do well as long as they have other support services that are going to encourage and motivate them through. I usually have a series of handouts that I provide patients, and in that handout I have the patient's heart, and I X out exactly where the intervention or where we did the treatment. So patients will take a picture of it, share with the family. If they ever had an event at another hospital or they're not local, another provider, another clinician will be able to know exactly what we did. Quite too often we see patients who say, yeah, I had a stent or I had this done, but they have no understanding of what was done and where it was done.
And there may be a language barrier too, right?
Certainly.
So that picture that they may take on their phone is going to come in really handy.
Exactly. So that's a sheet that they have, includes my business information. So if they ever need it, they're able to get back to us. And then I write down patients from step 1 to step 10, what the plans are. And we don't need to get to step 10 until they leave the hospital. But at least we can get to step 1, 2, and 3. The rest we can do it as an outpatient, but it's all written down so they have a mental process of where they need to be at. And that's an important process for every single patient we see that have heart problem, kidney problems, and problems to their legs.
Very interesting. Thank you for providing all that information.
Of course.
Peripheral artery disease. Let's talk about that. What is that?
Peripheral artery disease is similar to what we call cardiovascular disease, but it entices what we talk about, not the heart, everything else besides the heart. So kidney blockages to the neck vessels, more importantly, blockages to the leg vessel. It is one of the most under-recognized, under-diagnosed, and under-presented to primary care. Patients generally don't talk about it. What they do is, in a subconscious manner, they change their lifestyle based on how they feel. So they say, my legs hurt, I'm not going to do X, Y, and Z activity, but they don't try to seek what the underlying problem is. And a lot of times, patients who had had a stroke, who have had a heart blockages, or a heart attack, or kidney failure, they will have concurrent blockages in their leg vessels. It's just not identified or picked upon until patient reaches a delayed of care and they have catastrophic side effects, which is usually ulcers of the legs or ulcers that are not healing, and at that point it's too late, leading to, unfortunately, amputation.
Worst case scenario, amputation.
Worst case scenario, yeah. We know patients who have had amputation, at 2 years, only 50% of patients survive. So very drastic probability of most patients not surviving.
So again, just circling back is do not delay care. If something's wrong, you have some kind of discomfort, your leg hurts, go see your doctor.
Absolutely. And also for the provider, if patients have those risk factors, we should do additional testing or screening tool to identify and get taken care of it right away.
So peripheral artery disease, also known as PAD, how do you treat it?
So peripheral artery disease, one of the best ways of treating peripheral artery disease is getting patients in a supervised exercise program. We at Salinas Valley have a rehabilitation program right across the hospital that patients can go in and get monitored by our nurses to go on a treadmill and get supervised activity where every week they continue to escalate their therapy up, making sure the patients are doing well, they're not having any major side effect, and this is the best way to get that vessel opened up and allow all the blood flow to recover from the leg. Despite doing supervised program, we obviously try to do the best medical therapy we can get the patients on. We put them on blood thinners, we put them on medications to help with their legs, particularly smoking cessation, cholesterol management, blood pressure management. Despite all of that, if the patient continues to have symptoms or they have ulcers, similar to how we fix the heart vessels, we can go through the same access, either through the wrist or through the groin, put in plastic hollow tube, see what the blockage is, see where it is, and potentially fix it.
Other than performing angiograms and fixing blockages, what other cardiac procedures do you offer at Salinas Valley Health?
So at Salinas Valley Health, we do various different types of procedure. If you have holes in your heart that you're born with, we call them patent foramen ovale or atrial septal defect. These are holes that patients were born with. We can go in through the wrist or through the leg and go put in a patch to help fix that. If patients have valvular heart problems, there's a heart model right here. Patients have valvular heart problems. This is the main gateway of the heart. It's called the aortic valve. As we age, the aortic valve will continue to get tighter and tighter and tighter, and patients will start having shortness of breath, syncope, and heart failure symptoms. Now we are offering TAVR, which is going through the leg and putting a new valve in there. At Salinas Valley last week, we just got a new valve system in-house to be able to offer patients options of the two different valve systems. They each have their uniqueness, they each have their own benefits. And we're using the same valve system, now we're able to offer intervention of the mitral valve. So if patients start developing blockages or tightness of the mitral valve, we can put in the same valve in that position as also on the right side of the heart. So there are many different valvular options that we're being able to offer at Salinas Valley at this time.
What are the latest advancements in cardiovascular technology that are considered groundbreaking or state-of-the-art in the field of cardiology?
Yeah, so one of my partners, Dr. Jim Joy, he actually invented, in collaboration with other physicians, is what we call percutaneous transmural arterial bypass. It's short for PTAB, which is a detour system. Patients who have had blockages in the leg vessels, sometimes those blockages are 100% and there's no filling beyond that. One of the ingenious ways of fixing that is using the veins. Veins and arteries, they go line side by side. And so the PTAB system allows you to use a vein as a tunnel. So you exit the artery, go into the vein, and then you re-enter the artery more down to the leg and allow you to have a brand new grafted leg. And so far, patients have had remarkable recovery in their activity, wound recovery, as also the graft has stayed patent or graft stays open for long periods of time based on the data or the research trial that we have. This is a remarkable improvement and an option that we can offer patients who previously did not have availability to intervene upon those blockages.
Sure, and their quality of life, I'm sure, is completely changed.
And it's really important that patients do have options to get their legs fixed, because ultimately no one wants an amputation.
Right, right. And I do want to say that that procedure was first done here at Salinas Valley Health. That was last year, and now that same procedure is being performed at over 40 hospitals
Wow.
in the U.S. So it's growing, it's much needed. A lot of people are getting their life back
Yes.
without having to undergo worst case scenario, which is the amputations that you mentioned. So it's really fantastic, and we want to congratulate Dr. Joy if you're watching.
Salinas Valley will continue to do groundbreaking work.
Absolutely. So what happens when a patient has a blood clot and they come to the hospital? Can you walk us through what happens and what his treatment looks like?
Yeah, absolutely. So at Salinas Valley, we have something called a peripheral vascular team. So there's one peripheral specialist that's on call 24/7, 7 days a week. And when there is a blood clot, either in the legs or either in the lungs, usually the ER team will be the first folks to identify that, and we will get a call as a vascular team. And we'll identify based on blood work, based on the patient's symptoms and presentation to see how this patient should be treated. If the blood clot has transited and gone into the lungs, we will routinely get our pulmonologists on board, our lung doctors, to see what the best case scenario looks like to reduce that patient's risk. Quite often, an ultrasound or the echocardiogram of the heart is needed to see if the heart is taking any additional stress from the blood clots being in the lungs. And if that's the case, then something we talk about like a mechanical thrombectomy, that we can go in and take out the blood clots from the legs, or from the heart or the lungs to alleviate the patient of the symptoms.
So this is another great example of how our patients are in great hands when they come to Salinas Valley Health.
Absolutely, we're always available.
What about blood clots? A lot of patients are on blood thinners. What else can you share about that and managing that problem?
Yeah, so blood clots traditionally happen in the veins of the leg. Veins are responsible for bringing blood from the extremity, from the legs, the arm, and back to the heart. Because it's a slow flow, patients tend to have blood clots in either the legs, and that can travel and go to the lungs. This can be catastrophic, especially the size of the blood clot and the amount of blood clot that can happen. Over the course of the last 10 years, we have changed the way we treat blood clots. Some patients can be treated with the traditional blood thinners. Other patients, depending on how much blood clot they have, they should undergo a mechanical thrombectomy, which means we go in and we aspirate mechanical blood clots to alleviate them of their symptoms and long-term consequences. Patients who have had large blood clot to their lungs, if you go in and remove this blood clot, they have immediate improvement in breathing problems, they don't require oxygen anymore, and long-term, they don't have the complications of having hypertension or elevated blood pressure in their lungs. Blood clots in your legs, if there's long-term and it's not treated appropriately or it's just treated with blood thinners, patients tend to have a large leg, which can have a lot of swelling in the leg, and they can start having superficial veins that can sometimes seep fluid, which is not good for long-term management, and it can eventually lead to what we call venous ulcerations, which means they can ulcer because of how much fluid is built up in the leg. If treated in a timely fashion, we typically would like to go in and drain the clot out to alleviate them of their pain, and most patients feel remarkable improvement within the first 48 to 72 hours. They continue to be on blood thinners because our goal is to reduce the amount of blood clot burden. They remain on blood thinners, but long-term consequences and complications are remarkably reduced, and this is something that we currently offer at Salinas Valley Health.
We know that people with diabetes tend to have a lot of cardiac issues. Is the procedure or the problem that you just described, is that something that you see among diabetics?
We see among diabetics, more traditionally, we see patients who are obese, patients who have underlying cancer, or patients who have had long-standing travels. Smoker is another one, as well as patients who are on hormonal therapy. Those are the classic patient characteristics we see blood clots in.
So you mentioned hormonal medicines and cancer patients. Sometimes they require medications. Can some of those medications cause those problems?
It can happen, but usually it's not the medications, it's usually the underlying cancer.
I see.
And some patients have genetic profile. They have genes that have been passed down that can lead them to being more prone for having blood clots, which certainly we cannot change, but we can treat for that.
Okay. Is there anything else that you want to share with us today, or a piece of advice perhaps?
One of the nervous things about patients coming to a cardiovascular or cardiology clinic is being started on cardiac medications. We certainly don't want to give patients cardiovascular disease processes or don't want to diagnose up anything. I tell my patients, they have to have personal responsibility. Because they're out of school doesn't mean they don't have any homework. Their homework is their health. Health is wealth. They need to take care of themselves. They cannot come to clinic and expect us to just give medications and have to cure or treatment. I've seen over the course of my career, if patients can follow just minor changes in their health, make dietary changes long-term, every time they come to a cardiology clinic, instead of getting a new medication added on, I talk about taking a medication away from them. That's success. That's what they want to come to see to a cardiology clinic. They're excited to come to clinic because they know that they're curing themselves with their own disease process that happened over the course of several decades, but now they're no longer requiring medications. And that's what I like to educate and emphasize to patients when they come to my clinic. And the last thing is, we know over the course of the last 10 years, gut health is related to cardiovascular health. What you put in your body is how your body is going to respond to you long term. Inflammation, which is the body reacting to what you're eating, is a big reason why strokes happen, heart attacks happen, kidney failures happen, diabetes happen. And so it's very, very important to eat foods that are clean and not have a lot of sugar, cooked in poor oil, which is canola oil or sunflower oil, and then lean meats, so a lot of processed food. And long term, they'll only benefit them with their health.
And we live in the salad bowl of the world, so we have at our disposal all these fresh vegetables and fruits. So
exactly.
What would you say, though, to a patient? That's easier said than done, right? So you have a lot of people in this community who are out in the fields,
yes,
picking the berries and the lettuce and all that. For them, going to the grocery store, you know, they may not be able to spend the kind
sure,
of money that some of us can and bring that healthy food back. So what would you say to them if they come to you and they have some of these issues?
That's a great question. That's a societal dilemma. And we understand that healthy food, unfortunately, is not affordable. Mm-hmm. My recommendation to a patient is, you know, we want to nickel and dime somewhere else. You know, it's maybe on entertainment, maybe on shopping. Health is important. If you can spend a little bit extra on spending the right and buying the right kind of things, I think long term it's going to be affordable. And
okay. Think of your health as the greatest investment.
Absolutely.
If you are not healthy, you can't work, you can't take care of your children, you're going to end up in the hospital.
Yes.
And
you said it. That's exactly right.
So prioritize your health. Okay, great advice. Well, Dr. Kadakia, thank you for being here today.
Thank you for having me.
Yeah, no, of course, we appreciate your time, your expertise, and what you do for our patients, and we're so glad that you joined Salinas Valley Health a little over a year ago.
Thank you. It's my pleasure being here.
Of course. You are accepting new patients at
yes,
Salinas Valley Health, cardiology. You do need a referral from your PCP to come see you. If you do want to make an appointment with Dr. Kadakia, please call the number there on your screen. It's 758-2100. Salinas Valley Health Cardiology is located at 230 San Jose Street in Salinas. It's right across the street from our emergency department. Now, this video will remain on our Facebook page. Please like and share it. And you will also find this video and many other Ask the Experts presentations in English and Spanish, as well as our Ask the Experts podcast series in both languages on our YouTube channel. And to stay informed on a variety of health topics, classes, and health events, please follow us on Facebook, X, Instagram, LinkedIn, and YouTube. Thank you for watching. I'm Claudia Otero, and remember to
love your heart.
We do.